You are listening to the Final Say Radio Show, a Rappaport media production, with your host Brett Rappaport and co-host John Rappaport.
We're going to have our next guest on in just a moment, and very interesting. I know we spend so much time discussing on the program the Affordable Care Act, or Obamacare, if you will. And, of course, we do have our guest. Lawrence J. McQuillan is a senior fellow and the director of the Center on Entrepreneurial Innovation at the Independent Institute. And he's got a great piece in Forbes, and, of course, he's done so much work on this topic. Lawrence, it's a pleasure to have you on the Final Say Radio Show with Brett and John. Welcome.
Thank you so much for having me. I appreciate it.
It seems like we've been talking about this topic nonstop for half our lives now, and I think I wish it would just go away, but unfortunately it's not. And as hard as we try, as much as we spend the time pointing out the problems, but you've discussed a lot here, including reasons why it will fail, reasons why free markets make more sense, and I'd love to hear more about your perspective on where we are now, beyond the online registration being an absolute flop.
Sure. Yeah. I mean, I think this is not going to go away anytime soon, unfortunately. I think we're going to be talking about this for a long time. And it's mainly because, up until this point, it's really been a political football and kind of rhetoric, but now it's actually reality, and people are discovering now for the first time how this law will actually work and seeing the difficulties and the costs associated with it. So I think it's only the beginning of the public discussion about this and what should we do going forward. And there's, clearly beyond just the website glitches, which have been, embarrassing and basically prevented people from complying with the law in the initial stages. There's so many other problems that are becoming apparent. For example, when the president said, if you like your doctor, you'll be able to keep your doctor under Obamacare. We now know that's not true because a lot of health insurance plans that doctors accepted aren't represented on the exchanges. So if you're forced onto the exchange and your doctor only takes a particular plan and you can't buy it through the exchange, well, then you can't continue to see that doctor anymore. And also, employers are canceling policies because they just can't afford them anymore. A lot of individuals, of course, are receiving cancellation notices in the mail because the plan that they previously had isn't compatible anymore with Obamacare. So, again, those plans were allowing people to see particular doctors that they liked, and now they no longer are offered. So I think a lot of people are going to end up losing access to the doctor of their choice under Obamacare.
Yeah, and those are all valid points. Now, it's funny, I was looking at some articles coming out of from Kaiser, and hundreds of thousands of people at a time from different companies in various states, California, Florida, Pennsylvania, just to name a few, they're receiving notices saying that we're canceling your policy. Now you're going to have to find something else, but we hope you'll stay with us. And so the question is, when they were first selling this during the debate in 2008, 9, and until its passing, was you're not going to see your taxes go up one dime. Then we expect this to lower your cost by I think it's $2,500 per family. Those are just a couple of promises. Outside of the ones you mentioned, you'll be able to keep your doctor, and if you like your policy, you can keep it, and so on and so forth. It seems to me that on average, people are going to have to go find an alternative to what they have now, while at the same time, they may be paying significantly higher costs for less coverage, and ultimately, they may have these things that may not apply to them because they'll apply to people who are in a minority, but they're going to pay for it.
Yeah, you're absolutely right. The early indications are, if you compare apples to apples policies, what an individual, for example, was paying before Obamacare and what they'll be paying under Obamacare for basically the same coverage, on average across the United States, we're seeing premium increases for men of about 100% increase, so doubling the cost, in other words, and for women about a 60% increase in premiums. But as you mentioned, I mean, most people aren't even able to get the same plan that they had in the past. So oftentimes they're paying more for a plan that they like even less. So it's even worse of a deal for these individuals. And we're seeing companies across the country also trying to avoid. Now, of course, the president, delayed the employer mandate. And just to refresh everybody's memory, that was a mandate that if you had 50 or more employees, you had to provide affordable health insurance, or you were going to be penalized about $2,000 an employee. Now, the president delayed that, but as a result, that those penalties, and I'm not for penalties, but Obamacare was counting on that penalty money to help pay for Obamacare, the whole program. And so now that money is not coming in. So the financial picture for Obamacare is even worse. I mean, it was never fully paid for to begin with, but now by delaying the employer mandate, that money is not coming in, and it blows an even bigger hole in the deficit for Obamacare.
Well, yes, and you allude to and bring up an excellent point, the penalties. But in addition to the penalties, because of the failures of the online registration and other reasons, because the administration has basically failed in rolling this out, even though they've had years to prepare for this, with lower enrollment will also be lower inflows into this system, which will also drive up the cost to the federal government.
You're absolutely right. Yeah, I mean, that's a really important point that you just made, because that 100% increase in premiums that I mentioned, that's insurers, basically thinking early on that this system is going to work the way Obama described it, and yet they still had to double their premiums. Now we're finding out that all these what's called young invincibles, the young people that were going to have to sign up and get health insurance or pay the penalty. These people aren't going to do this, we're finding out, because the exchanges aren't working. And so as a result, I mean, they're not going to be bringing in all this additional revenue for health insurance companies, and they're not going to be bringing in the federal subsidies that were promised. So as you mentioned, I mean, 100% is just the beginning. I mean, we're going to have to see even higher premium increases than that in order to pay for the mandates that Obamacare requires, because now under Obamacare, insurance companies have to cover most preventive and diagnostic services. So that puts a financial burden on them. They were counting on all these young people signing up to pay for that, but if they don't, well, then they're going to have to increase the premiums even more for the people that buy it on their own or through their employer. So this is just the beginning of the price increases, unfortunately. If you're seeing, a doubling or tripling, I think it's even going to go higher than that when this is all played out over a couple of years or so.
Right, and now you discussed this in your article in Forbes, and it's the idea that because of Obamacare, the hours that people work are going to be reduced to have more people not fall under this, which, by the way, is going to mean less revenue to the federal government because people are earning less, and also it means that because people are earning less, you'll probably have more people collecting from social programs, which is another unintended consequence and cost to the government and taxpayers anyway. But we've pointed out a lot of the wrongs here. I want to give you the opportunity to provide the alternative. First of all, when could we fix this, if ever? And if we do get the opportunity to change this, what are some of the suggestions that you would have based on the research and work that you guys have done?
Well, there's a couple approaches to undo this. I mean, I think the most likely approach to actually repeal Obamacare is still through the courts, even though, of course, the Roberts decision came down and it basically upheld most of Obamacare. I think there's still a lot of other lawsuits moving forward out there in the federal courts that could still either undo Obamacare in total or at least chip away at parts of it. So I think that's probably the best approach to ultimately undo Obamacare and bring in something else. But there's also, you can go through Congress. There's the legislative approach, but that would require some significant changes in Congress in 2014, and then, of course, a change at the top with the president in 2017. So that probably would be the earliest that it could be repealed or radically reformed through Congress would be, 2017. But there's also, there looks like there's a growing movement to try to change legislatively the individual mandate and to delay, the requirement that individuals have to purchase insurance or be penalized. Even a Democratic senator today came out from New Hampshire and said that we need to delay it. So it's just not Republicans now. They're trying to get, the individual mandate postponed, but also now one Democrat. So I think there's a chance for that small part happening, which would save the federal government about $35 billion a year if you just delayed the individual mandate for 1 year because of all the subsidies and the tax effects of it. So that would be, I think, an important victory. But in order to really radically reform it, I think it would take until 2017. Now, in terms of what I think is necessary, I think we're not going to really bring down health care costs in the United States until we give consumers more control over their health care dollars. So, for example, one approach would be to give every man, woman, and child in America a $2,000 refundable tax credit that they could use to go out and buy their own health insurance under your own name. So, for example, if you owed no federal taxes, you get a check for $2,000 from the government that you could then use to purchase your own health insurance under your own name. You could take it anywhere. It would be portable. It wouldn't be tied to your job. It's crazy that we get health insurance through our job. And it would largely solve the pre-existing condition problem, too, because most people face that problem when they switch insurance companies, oftentimes when they change employers. So this would allow them, though, to keep the insurance policy under their own name, and they could buy it with pre-tax dollars just like employers do. So it creates a level playing field between the individual and the employer. And if you owed, let's say you owed $10,000 in taxes to the feds, it would reduce your tax bill by $8,000. It would knock off $2,000 as long as you use that money to purchase health insurance. So you're basically buying health insurance with your own money. It allows you to keep more of your own money to buy health insurance. And you could add to it. Your employer could add to it. Medicaid could add to it if you're poor. But it would really allow people to make their own decisions and put the individual on a level playing field with the employer so that you could keep the policy and buy the policy under your own name and take it anywhere you went. I think that's a real simple, reasonable, easy to understand alternative to this crazy maze of rules and regulations that the president's trying to set up with Obamacare.
Yeah, Lawrence, I think you make great sense. First off, if you look at how much less money we would spend if people really looked at medical insurance to cover major medical health care issues, something that would really change the structure of your life, that will cost your home, your cars, your jobs. The fact that people are using it for things like birth control, basic physical augmentation, just because they want to look better, or every time they have the sniffles, is lunacy. And of course, they make the argument that, well, we have to do that. We have to have Obamacare because currently we pay for it anyway because everybody goes to the emergency room. Who's to say you couldn't have legislation that said when you step into an emergency room, if it doesn't meet the following criteria, which by the way could even be posted on a wall, you're not getting it for free, or you will pay for it. I think we know the difference between a heart attack and a compound fracture and the sniffles, right?
Right. That's absolutely true.
You could have common sense here.
You could. For example, we don't have auto insurance. We don't have it for flat tires and oil changes. We have it for major collisions, major risky events that are, incredibly expensive or at least reasonably expensive to take care of. And I think that's how health insurance should work. We have insurance for the bigger items, and then the smaller items we would pay through, for example, a health savings account that would be under our name. and you could keep the dollars. You wouldn't. It's not a spend it or lose it account, but you could actually keep the money in the account. So it would encourage people to shop sensibly to purchase preventive care and diagnostic care, and search around for the best doctor at the best price that they can afford. It would really inject competition into a segment of our economy that really has very little competition, because people don't spend their own money for the most part, so they're not really aware or concerned about the cost. They present a little card, and the card takes care of most of it, so people just don't ever see a price. I mean, when's the last time you've ever seen a price listed in a doctor's office? I mean, it's very rare unless you walk into like a walk-in clinic or something. But that's kind of the better model, is a walk-in clinic type approach where you pay for the more minor things, you have insurance for the major things, but by giving consumers more control over their own healthcare dollars, I think you'd also create big incentives then for a lot of innovation in terms of how you deliver care. And I think you'd see more email care, you'd see more telephone care, more walk-in clinics, that sort of thing, more convenient access to doctors for simple things, and then you'd have insurance for the major things.
Well, it's funny you say that. I personally think this is nothing more than a permanent vote-buying scheme. And one of the things that really concerns me is, being a high-tech entrepreneur myself, I know for a fact that in only a couple of years, companies can go from nowhere to creating and providing global solutions to virtually any problem, healthcare delivery not being any different than those. And to create another permanent bureaucratic behemoth that will always be slower than technology, will never be anything representing a reasonable, efficient machine, I think is going to end up making healthcare much worse for many people. And I want to get your opinion. Based on that supposition, I believe there's going to be an enormous delta in healthcare, because the people who actually have money, it's hard for me to imagine there won't be a robust, even if it has to occur offshore, boutique healthcare service, meaning you're going to have boutique or bust and maybe nothing in between in terms of healthcare service quality.
Right, I think you're right. I mean, keep in mind about half the financing for Obamacare is going to come from reducing Medicare reimbursement rates. So the plan was to shift money out of Medicare by reimbursing doctors and hospitals less and transferring the money over to Obamacare, and particularly the subsidies for the exchanges. And so what's going to happen? I mean, doctors aren't going to sit still and receive, half of what they were getting before in terms of a fee. They're going to transfer out of providing Medicare care, and they're also going to transfer out of Medicaid care, which they already are because the reimbursement rates are so low. I mean, a lot of doctors don't even take Medicaid patients. So that's going to be ramped up. You're going to see either doctors retiring, or they're going to be going into boutique type of services, or the more specialty care where they get higher reimbursements. And as a result, what you're going to see is worse care for the poor. And I know Obama likes to say how this is going to benefit the poor. I think it's going to work actually to the opposite effect, because there's nothing in the law that increases the number of doctors or hospitals or nurses or clinics, nothing. So they're going to be having all of these new people under Obamacare. There's anywhere up to 30 million newly insured if it worked the way the president plans it will work eventually. And they'll all be looking for more services, and yet there's no more doctors to provide it, and the fees to doctors for Medicare and Medicaid are going to fall. So you're going to have a lot of frustrated people. A lot of poor people are going to be waiting in long lines, rationing care. They're going to get frustrated. They're going to drop out of the system. They're not going to get the care that they need. And I think it's actually going to be worse for the poor and the elderly, because the doctors are going to move to where the money is, and it's not going to be in care for them. It's going to be kind of these boutique concierge-type medical providers, and we're going to see more of that. And unfortunately, it's going to be the poor and elderly who are going to be hurt most, I think, under Obamacare.
Well, you're exactly right. It seems like for years I've been saying this. It seems that the Democrats in major cities where you have a lot of more higher concentrations of poor, that they've been pushing these programs, more social-like programs, to help them but ultimately they end up either keeping them more entrenched in where they are anyway, or exasperating the problem. And I think that you're exactly right. It's another case.
Yeah, I mean, think under Medicaid, poor people can't add to whatever the government pays the doctor to provide whatever service they have. It's against the law for a poor person to kick in a little additional money to the Medicaid reimbursement amount to get better service. I mean, that's ridiculous. Why would that be? I mean, it just harms poor people, locks them into substandard care. It creates a two-tiered system. I mean, you should allow at least a health savings account approach where poor people could put in like Medicaid money into their own account, control the money, and be able to add to whatever Medicaid is willing to reimburse the doctors so they can at least get, market rate. They can pay market rates for good quality care, unlike the current approach. I mean, the current approach really disadvantages the poor, and it's going to be even worse under Obamacare.
That's absolutely right. Well, Lawrence, I want to thank you so much for joining us today. If you could please give the website where people could follow you, we'd greatly appreciate that.
We have a great book on this subject. It's called Priceless, Curing the Healthcare Crisis, and it's available on our website at independent.org.
Okay, so independent.org, and of course this is Lawrence McQuillan, who is the Senior Fellow and Director of the Center on Entrepreneurial Innovation. We really appreciate you spending so much time on this topic, and it's very important, and we really appreciate the thoughts that you've shared with us today. Thanks again.
Thank you so much. I appreciate being on your show. Thank you.
Okay, take it easy.